So we're here at the American Society of Hematology 2024 annual meeting. My name is Jeff Lancet. I'm the chair of the Department of Malignant Hematology at Moffitt. And joining me today is Dr. Ariel Grajales, one of our faculty members in the multiple myeloma section. And Ariel, there's been a lot of interest and development in bispecific antibodies in myeloma. Can you just tell us a little bit about where those types of treatments exist on the current myeloma landscape?
Thank you, Jeff. Thank you for having me. And in reality, absolutely, bispecific antibodies have kind of revolutionized the treatment landscape in myeloma nowadays. Since their original approval, now we have 3 different products that are indicated for patients with relapsed refractory myeloma after 4 prior lines of therapies. And we have to admit that the overall response rates that we're seeing with them are absolutely outstanding, because we're talking about single agent activities that all of them surpass the 60%, whereas historically we only had single agent activity in the 30% and below. So that's absolutely phenomenal to see for such a difficult to treat population, especially because we're talking about patients that have received on average 6 lines of therapy. So that's quite impressive on a very heavily pretreated population per se. And it's an evolving field. So it's absolutely great to have.
So you have some data you're presenting here on real world, real life experience utilizing bispecific antibodies in myeloma. Tell us a little bit about your research and your presentation.
So yeah, thankfully we've been fortunate enough to work on the real world data for bispecific antibodies, which is extremely impactful. In reality, most of the patients that would receive bispecific antibodies on a clinical trial are not necessarily the ones that you see in real life. So just having the opportunity to include those patients and publish that data it's impressive. And we have had work as a single center and also through a consortium, which gives us even more data per se. The single center experience that we're presenting here is regarding talquetamab, and we've seen outstanding results with overall response rate that actually not only mimic but surpass the data found on the original clinical trial. Overall response rates that are phenomenal in the 80%, with progression-free survival of 15.6 months, which is, once again, in this type of population, unheard of, especially on the post-CAR T era, because CAR T now has become the leading edge for those patients, and now it's earlier lines of therapies that it's been approved for. So it's absolutely gret.
It's very impressive. And then one last question in 15 seconds for people who may be listening and maybe not be as familiar with this type of therapy. Very briefly, how do bispecific therapies work, and what is their advantage?
Bispecific antibodies are phenomenal. I call them the matchmaker, because basically it has 2 targets, CD3 and whether GPRC5D or BCMA or any other target that is expressed in the myeloma target, and we use the host's own immune system to basically fight the cancer. And the great advantage that they have, it's off the shelf and the patients are ready to go whenever it's appropriate. So it's just great.
Awesome. Great work and exciting times in myeloma for sure.
Yep.
Thanks.
Thank you.